So here we're going to go over Section 5B. It's acquiring and transmitting 12-lead ECGs for adults and pediatrics. We have 19 indications on when we would want to obtain a 12-lead. Respiratory rest, dyspnea, chest pain, ACS, strokes, syncope, poisonings. Pretty much anytime you're putting a 4-lead on, if you can get a 12-lead, it's going to benefit you in some sort of way. Even if they're not having heart problems, you can always, throw a 12-lead on them just to make sure that you're not missing anything, just to cover all your bases. For contraindications, if the transferring facility has already obtained a 12-lead ECG confirming STEMI prior to EMS arrival, transport is not to be delayed in effort to obtain an additional 12-lead by arriving EMS professionals. Serial 12 leads for transmission to receiving facilities are to be obtained during transport. So pretty much what's that, the only contraindication, and what that's saying is if you're picking up a transfer from a facility and they have already determined that the patient is having an active STEMI and they're being transferred to a different hospital for better care, cath lab, whatever it may be, then we're not going to delay care to get our own 12 lead. We can take their 12 lead with us. Most of the time they'll have already sent that to the receiving hospital or whatever it may be. So just don't delay care to do another 12 lead. We want to get that patient in the right place as quickly as possible. So the technique for obtaining 12 leads, number one, you're going to prepare the skin for electrode application. This may include hair removal with razor and or rubbing the skin with gauze, sterile or non-sterile, to remove oil and sweat. Both actions contribute to better electrode adhesion, leading to better quality 12 leads. For standard 12 lead ECG, apply leads and electrodes as follows. So if you look down here at the bottom, it shows you a chart, like 3 different pictures of where you're going to put your electrodes. For your initial 4 lead, it shows on figure 1 that you will put them on the forearms of the right and left arm, and then the inner legs, which would be like the inside of your ankles for the limb leads. You're not always going to be able to do this. If you have to put them on the chest and the stomach or on the abdomen, that's okay. It's different people have different opinions on how to make a cleaner 12 lead. Different cardiologists will tell you different things. As long as you have the right arm on the right arm and the left arm on the left arm, right leg, left leg, then you'll be able to obtain a 12 lead. If the 12 lead or your initial 4 lead rhythm is ugly or messy, then you may think about, moving them around, seeing if you can get a cleaner picture. So for this protocol, we're just going to go through and read number 2. Right arm on right upper extremity, preferably distal on the extremity near the wrist on the palm side. The left arm is the same as the right arm, it's just on the left upper extremity. The right lead is on the right lower extremity, preferably distal on the extremity near the ankle. Left is the same, just on the left side. V1, the V1 lead is to the right of the sternum in the 4th intercostal space. I would definitely know these intercostal spaces, hint, but it does help you with your 12 lead placements too. So V1 is the right of the sternum in the 4th intercostal space. V2 is a mirror image of V1 to the left of the sternum in the 4th intercostal space. V4, if you notice, we're going to skip V3, and there's a reason for that. V4 is placed next and in the midclavicular line in the left 5th intercostal space. And then it goes back to V3 and talks about V5. I'm just going to explain how I do it. I'm going to put V1 on, V2 on, and then I'm going to throw V4 on, and then I'm going to throw V6 on, which is in horizontal line with V5 at mid-axillary line of axilla. So it's pretty much right underneath the armpit. And then you can go in and put V3 and V5 in between the necessary spots. So V3 is going to be in the middle of the line now created between leads V2 and V4, and V5 is the horizontal line with V4 at anterior axillary line of the left axilla. So that's how you're going to do it. Obviously, this isn't always going to happen. You may have those patients that have some weird anatomy, rather that be a female or male or whatever the case may be. So just do what you can to get them in the closest possible spot. If you have to move them down or up a little bit, that's okay. You want to avoid putting these 12 leads on direct bone contact. You're not going to get a very good picture on the if you're putting them directly on the bones. If your paramedic says, or if paramedic wants to do it, or they're telling their EMT to do it, if you need a right-sided 12 lead, that's going to be figure 3 right below here. And this is going to give you a picture of the right side of the heart. And all you're going to do for this, you won't do this until you do a regular 12 lead. Your regular 12 lead is showing that it's having a right-sided infarction. Then you're going to do what they call a right-sided 12 lead. And so all you're really going to do is move leads off V3 and V6 and place on the right side of their chest exactly how it was on the left side, if that makes sense. So it'll be V3R, V4R, V5R, V6R. So you'll move all of those pretty much over to your right side. And then you also have posterior 12 leads, and we can get into that a little bit later. We'll scroll down to the next part, and it's just going to tell you how to obtain the 12 lead and what we do. If you're obtaining the 12 lead, your monitor is already on. You've already got the 4 lead on. So you've got your 4 lead cables on. You put your 12 lead cables on. You do have to plug in the 12 lead connector to your 4 lead. It's got a little lid deal that will pop off. You plug that in, and then you can do it one of two ways. You can go to options, and it shows over here on the figures 4 through 12 on how to turn it on, transmit, all that stuff. But if you go to options and press patient, you can go ahead and click female or male and then their age. That way when the 12 lead is ready to take, whenever you press 12 lead, it'll automatically start obtaining. If you don't do that and you click 12 lead, it will pop up with the sex of the patient, male or female, and then it will ask you their age. And then once you click their age with the dial, it will instantly start obtaining a 12 lead. So to transmit the 12 lead, if you go back into options like we talked about, and this is why I like to go to options instead of just doing it on the 12 lead. If you go into options, you can type in their first and last name and then their age and all that stuff. And then once you go to transmit, if you go to transmit, you hit transmit, and then you can select the appropriate facility wherever you're going. With that being said, we do not do that very much anymore. The ambulance side of the fire department will use ESO alert, where they can attach their 12 leads and send them that way. And the fire department, we don't usually transmit 12 leads ever anymore anyways, because we have the ambulance now. So that's how you do that. If you do need to transmit, you just hit this transmit on figure 9. You go to report. On figure 10, you'll click whatever 12 lead. 12 lead 1's obviously going to be the first one you took, and if you took 5 12 leads and you want to send the third, you'll go to 12 lead 3. And then you'll select your facility if you need to transmit it for whatever reason. So we'll keep scrolling down. It says, note, these are there limitations with transmitting data by telecommunications. Successful transmission depends on the access to public or private network systems. So it's just talking about the essentially the Wi-Fi or the internet connection. So depending on where you're at, you may not be able to send a 12 lead on ESO, or you may not be able to send a 12 lead or transmit a 12 lead on the monitor. So just be mindful of that. If when you call in these 12 lead, or when you call in a STEMI and you're telling them what's going on, just tell them where the elevation is on the 12 lead. You don't have to go into too much detail, but you can tell them there's 2 or 3 boxes of elevation and 2, 3 in ABF with depression in the lateral leads or whatever it is. So that's how you set up the 12 lead, how you do the 12 lead. Again, the whole transmission part, we typically don't do that much anymore with ESO alert. So you can disregard that for the most part. But if ESO alert ever fails and we have to transmit, that is still an option. And that is going to be it for that. So we'll move on to the next one.